Hi, today we're going to be talking about physical activity. Before we get started, I just want to touch base on the action plans. So as of today, you should have 2 action plans complete. So you should have your session 1 and session 2 action plans complete. Those action plans were not on a specific session in the workbook, or it was kind of whatever you wanted to improve, whatever you wanted to work on. I'm hoping it was health related. If it was not, it's not a big deal. I'm actually going to email each of you and just ask for a quick update if you have any questions, concerns, and if you do, hopefully I'll be able to help you with those. But yes, please be on the lookout for a follow-up email because I am curious on how everyone was doing. All right, so I'm going to, once again, I'm on the laptop. I'm sorry it's a little grainy. For this session, we have several slides for it, so I need to screen share. And this is the easiest way to screen share. So let's see. All right. Like I said, session 5, physical activity. In earlier sessions, so I guess I should back up. In your workbooks, you can kind of see that. Let me get to that same page. Physical activity, session 5 in your workbook. On page 2, you'll see the questions that we will be answering today. So why is physical activity important? How can physical activity help control hypertension? How much physical activity do people need? How does physical activity help people lose weight? How can I become more physically active? And what are the different parts of a physical activity plan? So after this session, you should be able to answer each of these questions that you see on the screen. All right, let's get started. So in earlier sessions, we talked about how important physical activity is. We've learned that being physically inactive puts people at risk for heart disease and stroke. Heart disease is twice as likely to develop in inactive people as in people who are physically active. Physical activity is in any movement of the body that uses energy. Walking, gardening, pushing a baby stroller, climbing the stairs, playing soccer, or dancing the night away are all examples of being active. For health benefits, physical activity should add up to at least 30 minutes per day. Men, women, and children are less active now than in the past. So it's no surprise, we hear that all the time. Fewer than half of all adults in America get the recommended amount of physical activity. Regular physical activity is important at all ages. Middle-aged and older people benefit from regular physical activity just as much as young people do. All right, if you want to turn to page 3 in your workbooks and just fill in the blanks as I continue. There are many reasons people should try to be physically active each day. For example, physical activity can lower the risk of heart disease, lower the risk of having a second heart attack in people who have already had one heart attack, lower the risk of stroke, and then lower the risk of developing type 2 diabetes. Of course, there are more. So it also can lower both total blood cholesterol and triglycerides and increase HDL, which is the good cholesterol. It can strengthen your heart and lungs. It can help you feel better about yourself, builds confidence, lowers your stress, helps you sleep better. It also gives you more energy. All right, so this is when we would discuss kind of the benefits of physical activity and how it can directly affect your blood pressure. So we would normally have a group discussion about this, but we'll just kind of go over. So it can reduce your both systolic and diastolic blood pressure on average of 10, can decrease the amount of medicine you need, improves the health of the heart and the blood vessels, and it also helps with weight loss, muscular fitness, stress management, and flexibility. All right, so there are 4 types of physical activity that are important for staying healthy and fit. So we have our aerobic fitness, strength training, flexibility, and balance. Aerobic activities are any activity, for example, walking, jogging, swimming, or raking leaves that increases the heart rate and breathing rate for an extended period. Strength training builds muscles and increases metabolism, helping to keep people's weight and blood sugar in check. Even small increases in muscular strength can make a huge impact on overall fitness. Stretching gives people more freedom of movement to do the things they need to and like to do. Flexibility is an important part of any exercise plan. Try to stretch when the muscles are warmed up. So typically after an aerobic activity. It's important to stretch in a static manner. So you don't want to bounce around when you stretch, which I feel like it's kind of one of those, it's easy to do. Most people want to bounce when they're stretched, but it's better if you don't. And then stretch the major muscle groups for 10 to 30 seconds, about 3 to 4 times each. And balance exercises build leg muscles and help prevent falls. These exercises tend to overlap with lower body strength exercises. We want to focus most on aerobic activity in order to help control high blood pressure. And like I mentioned in previous sessions, so you guys did get this added bonus book and chapters, I believe it's chapter 6, 7, 8 is when this book goes over physical activity, and it also gives you some examples of physical activity and balance exercises and stretches. And so yeah, I want to check this book out. So here's kind of an example of some stretches that they do. So check out chapter 6, 7, and 8 in this little bonus book. There are a few things to know that you should know before starting to become more physically active. Most people can safely increase their physical activity if they start slowly and sensibly. Before beginning, it's important to talk to your doctor or nurse because you have been diagnosed with blood pressure. You should also talk to your doctor if you have arthritis, diabetes, any other heart condition, pain or discomfort in the chest brought by vigorous physical activity, you have dizziness, and then any other chronic conditions that you think are an issue. If a person has had a heart attack, it is important that he or she talks to the doctor to get help in planning a safe activity program that will help prevent heart pain and further damage from overexertion. People who include physical activity in their lives have a heart attack, after a heart attack, improve their chances of survival. So if you turn to page 5 in your workbooks, I'll kind of do the same. There's a little questionnaire that you can, to see if you are ready to be physically active, there's a little questionnaire. So if you're not currently physically active, there's a questionnaire on page 5, and it will, if you answer those questions, it'll kind of tell you if you are ready. But regardless, definitely speak with your primary care provider. If you do not have a primary care provider, please feel free to reach out to me and I can get you referred to one. So it's important that you do the following. You need to drink plenty of water before and after exercising, even if you're not thirsty. Special drinks such as Gatorade, they aren't necessary. They're not needed. So kind of just stick with water. You need to wear comfortable clothes and wear shoes that give your feet support. And then don't wear clothes that are too heavy. Put off physical activity if you have a fever or are ill. And examples of each of those, examples and more information is in your appendix after this session. So after session 5, there's more information. Many communities have recreational facilities such as a park and community centers that are open to all without cost, and many offer free or low cost classes. Oh, that's kind of hard to say. Sydney, we are a little more restricted. I know there are some community centers, or I guess even county buildings that have activities, programs, workshops that you can be physically active, that you can work out at. Are they free? There's usually is a little fee to it, but yeah, we are a little restricted here because I know we do currently have 3 gyms here and they all require a membership. so it kind of can be a barrier for some, but I will send out an email later today and just kind of give you guys ideas for if you want to join kind of a workshop program, whatever it may be for physical activity. I'll send you guys an email. Right now it's kind of a little more restricted just because of COVID, but I will, at least you guys will know what to look for when things pick back up. There are a variety of enjoyable physical activities. The key is to find one that you like. If you like it, it's more enjoyable, you don't mind doing it. It doesn't seem like such a chore. Some of the most popular are walking, gentle exercise, swimming, water aerobics, weight training, Tai Chi, and gardening. And of course, in your appendix, there is a handout. It's called Ways to Add Physical Activity to Your Life in the back of session 5. So there's more information in that handout. If you're still unsure which type of activity might be best for you, try walking. Walking doesn't require special equipment, it doesn't cost anything, and it can be a lot of fun. You may have heard that we should walk about 10,000 steps each day to promote health. Research tells us that such a general recommendation, so I was going to try to not break this into 2 parts, but I'm going to have to. So I'm going to pause this part and then I will pick back up right where I left.